A concern or even criticism I often hear from patients about repeated movement testing is, how can we tell this isn't just from a warm-up effect? And I think this is a very valid concern, and it's something in the back of my mind when we're doing repeated movement testing. That is, I'm asking myself, is the person just better because the person moved, or is the person better because we moved a joint in a very specific direction under a specific load? But we want to figure out what it is, because that will obviously help with decision-making regarding diagnosis and therefore treatment. One way of telling if it's a warm-up effect or if the repeated movement in a specific direction holds merit is to see if things change over the course of a few days. If you're just moving better and feeling better after, say, 30 knee extensions, then that may last for 10 minutes or 30 minutes or an hour, but it wouldn't get cumulatively better over 3 days. But if the repeated movement is the right movement for your knee, then you'll see gains over those few days. It won't just feel better for half an hour or an hour. It will start to noticeably feel better throughout the day, and day to day you'll be better over the course of several days. Another way I can kind of tease them apart is to think about what movement we're doing in what location and where the signs and symptoms are. If a knee is lacking range of motion and the knee has pain with squatting, but we're doing a lumbar movement, well, I wouldn't really think that a warm-up effect by moving the lumbar spine would affect mobility at the knee. It might, but it's a little bit of a stretch to get to that explanation. Also, I don't think of signs and symptoms like strength changing due to the fact that a patient is warmed up. So if the patient has weak shoulder abduction, for example, and I do the repeated movement test of shoulder extension 20, 30, 40 times, and now that shoulder abduction is 5 out of 5, it's full strength, it's hard for me to wrap my head around the patient being warmed up and therefore the strength being more robust. That's why we take lots of different signs and symptoms so that we can retest with repeated movement testing to look for cause and effect. Yes, some of those effects may be due to warm-up, but we need to measure change over several days when we keep doing that one specific motion. We need to look at not just, do you feel better? Symptoms, usually pain. We also need to look for, are you moving better at that location and at distant locations? And are you stronger? Do you have more nerve extensibility, etc.? Looking at that whole picture should help us figure out, does this patient just need general movement? Because when they don't move, they feel stiff or they feel pain. And when they do move, generally they will feel better. Or is this someone who may have a diagnosis of a mechanical joint derangement, who needs repeated movements every couple hours in a very specific direction to actually fix this thing? Or of course, are there other diagnoses? But teasing out the warm-up effect is important because we want to make sure we are not just taking the results and attributing them to a specific repeated movement when in fact they're just due to general movement.